Hi Fools, healthcare analyst David Williamson. Shares of Pharmacyclics are soaring today, up nearly 20%. So what was the catalyst? Ibrutinib, now called Imbruvica, since it was approved for mantle cell lymphoma, just had its phase 3 trial for chronic lymphocytic leukemia stopped early. Stopping a trial early is often a sign of an ineffective drug. In rare cases, though, it is because the drug is working so well, it's considered cruel to keep the drug from those on the control arm. And this is exactly one of those cases. Ibrutinib showed a clear improvement both in terms of progression-free survival and overall survival over its head-to-head competitor, GlaxoSmithKline's Arzerra. Now, this should easily be enough to expand Imbruvica's indication to one of the most common forms of blood cancer. What's interesting here, though, is despite high expectations, for Arzerra, when Glaxo licensed the drug back in 2006, it's been more of a bust than a blockbuster. So I was a little surprised that Imbruvica went against that instead of Roche's Rituxan, which is the dominant player, did just shy of $7 billion in sales in 2012 for several indications. Roche also just launched a next-generation version of the drug, GA101, which helped patients live a year longer versus Rituxan. This is the big challenger for Imbruvica, especially depending on what happens when it's combined with AbbVie's ABT199. The potential combo product would look to stop all treatment after 6 cycles, which would be roughly 6 months, instead of keeping them on continuous treatment, which is what Imbruvica does. Now, Imbruvica is going to be a mega blockbuster for Pharmacyclics and its partner Johnson & Johnson. J&J was incredibly smart to license Imbruvica when it did. It's definitely a big feather in its cap, and investors in both companies should be excited. However, I want to caution new investors that a lot of those sales are priced in, and at these prices, especially on the Pharmacyclics side, I see potentially more downside than upside for investors unless Pharmacyclics can continue to add indications to Ibrutinib that are seen as less likely than CLL, or deliver more success from its drug pipeline. Thanks for watching. Stay tuned to Fool.com for all your investment news, and Fool on.